All right, well, we're going to get started, and so welcome everyone. I really just wanted to say hello to all of you, and for those of you that may not know me, so my name's Jen Perry, and I'm the president and co-founder of the Li-Fraumeni Association, otherwise known as LFSA, and I really just want to welcome each and every one of you today, both here in the U.S. and also our international family as well. I already saw that Europe is on here, and some other countries, so this is very exciting. And you know, our organization really more than anything just wants you all to know that we're here to support you in these truly challenging and really unprecedented times that we're all trying to navigate through. And I hope you're all staying safe and as healthy as possible, and whenever possible, really minimizing your risks. You know, as an LFS patient myself, I struggle with the same fears and questions that all of you do. As if a pandemic wasn't scary enough, those potentially at high risk, well, that just adds to the stress that so many of us are experiencing right now. So here at our organization, the LFSA, we want to always continue our mission of education and support, and to be really a layer of comfort for all of you in this unsettling period. So today we're going to bring you a special webinar with an incredibly talented panel. And I'm really grateful for their time. As you can imagine, the workload and pressure that all of them have on them right now. And they've taken a pause in their really busy schedule to take the time to be with each one of you. So grateful for them. So want to give you one moment here. So here are the people that are going to be on our panel today. So we have Dr. Josh Schiffman, as you know, from University of Utah. And we have Luke Massey, and then we have Wendy Coleman. They're all from the Huntsman as well. We have Jenny, am I saying it right, Vogger? Hi, Kara. And Kara Maxwell from UPenn. So thank you all for being on here, and so appreciative of it. We have had so many questions submitted already in advance, and we gave the panelists those questions. And there might be very many that came in a little bit later that they might not have. So all of you will have the opportunity to raise your hand and ask any questions that you might have. So if you have anyone you know that was unable to attend today, don't fret, because just pass on the word that we're recording this. So we're going to put this up on the website as soon as possible for each one of you, so that everyone will be able to view it. So before I turn it over to them, I do want to talk about one thing, because one of the questions that came out quite frequently was, okay, is the symposium on in October, Reach 20? So guess what? The organization has had so many questions on this, and we are still planning on having this exciting event. After much discussion with the planning committee and with the Life Consortium, we are moving ahead with the symposium. And although we're simultaneously, you know, working on Plan B, Plan C, what does that look like, whether that's virtual or electronic, we're really hopeful that by the beginning of October, life will be getting back to normal. Okay, maybe the new normal, but hopefully we'll all have something very exciting to look forward to. It's really a time that we can all get together to support one another and to learn. And if there's one silver lining to being an LFS patient, family member, or friend, or really any type of medical professional that works with LFS, is we are resilient people. We're determined, we're compassionate, and we never ever quit. You know, Boston promises to really be a lot of fun in October. Fall's just starting. It's honestly my favorite time of the year. I love the fall. The Jimmy Fund Walk will be happening that weekend. Indian summer will just be ending, so it still should be a little bit warm. And we have a lot of special events planned. Friday night, it's kind of super secret right now. I don't want to spill the beans on it yet, so you'll have to stay tuned. But Friday night, we have a really fun event planned. You're not going to want to miss it. We have a large celebration Saturday night for two things. It's for LFSA's 10-year anniversary, and the 30th, or the Pearl anniversary, of the discovery of the germline mutation of P53 is what caused LFS. So as Thomas Edison said, well, to have a great idea, have a lot of them. And I can guarantee you all that we are continuing to plan appropriately as the year progresses, but we are moving forward with the symposium. And that's going to take place at the Boston Marriott Copley Place. And I think you've already seen the first email that's gone out about that. And you can see here the dates are October 2nd through the 5th. And it is hosted by Dana-Farber Cancer Institute. And the entire event will actually take place at the hotel. So we won't have to worry about transporting back and forth right now to Dana-Farber Cancer Institute, but they are helping us plan this every step of the way, and they are the host. So we're so grateful and very excited to have them at our side. So get excited, stay tuned for more details for really an incredible affair. So without further ado, I am going to turn it over. Is Luke on? Luke's not on yet. Okay. So Kara, welcome. How are you? Whoops, I'm not sure if I can hear you, Kara. Did you take yourself off?
I don't know if you can hear me now.
Now I can hear you now.
Okay.
Yep, perfect. Welcome.
It was weird. My computer audio wasn't working for me to hear you, but you can hear me, so that's okay. That's all good. Trying to learn life with Zoom is hard for my children, for me, and everybody involved, I think. We're sort of hanging in there here in Philadelphia. We're a little bit behind New York, and so we're currently surge planning, and all of us being pulled, to a variety of services that we aren't necessarily board certified in, but we are all, hanging in there, I think, is the best way to say it.
Well, that's good. Well, thank you all for being here. And I know we put in a bunch of questions. I think you have some of those with you. Do you guys have those questions?
Yeah, absolutely. Just need to get out of full screen so I can, there we go.
And there are more, I'm sure, that are going to come through, and we've already got some that are coming through. So maybe we can start with the ones that were already submitted.
All right. Is Dr. Schiffman on, or is it just
he's
Wendy
coming
and
on
I?
shortly. He'll be on shortly. He had an COVID meeting as well. He'll be coming on shortly.
Okay. So I'm just trying to look, let's see, webinar questions. Okay. Let me try to pull this up.
While she's pulling that up, so just so everyone who's on the webinar, you had an opportunity to send in some of your questions in advance, which is what I sent to our awesome panelists here. And as you know, we have a range of different talents on this panel so that they can hopefully answer as best we can all the questions. And any questions we can't answer on this, we'll make sure we get out the questions and answers to you after as well. And we can also put them up on our website when we put the recording of this webinar up there as well.
So I have the questions, and I'm just going to start from the top.
Yeah, absolutely.
My 3-year-old niece has LFS, was born premature, and has respiratory issues already. What precautions do we need to take for her? So I think that I'm not a pediatrician, I'm an adult medicine doc, but one of the sort of, I think, main take-home points that I wanted to start out with is actually 2 main take-home points. So number 1, at this point in time, we do not believe that COVID-19 will differentially affect any Li-Fraumeni patient or any patient with a genetic predisposition to cancer as compared to the general population. So you can be reassured when you read things, again, from reputable sources online like the CDC, that the things that they are stating that are referencing the general population are applicable to patients with Li-Fraumeni syndrome. That said, given this particular question of somebody with other respiratory illnesses, then that applies. What we're telling the general population is that if you have an underlying disorder, like a respiratory disorder or something else that would make you immunocompromised, and we can talk about that later, but let's specifically focus on the question here, which is other pulmonary illnesses. We do believe that people with other pulmonary illnesses are at increased risk for coronavirus-related complications. And that could simply mean because something about the biology of the disease, but it could also mean that if you were to get a bad pneumonia for any reason, from any infectious pathogen, if you have underlying lung disease, that would increase the complication rate from any kind of respiratory pathogen, including coronavirus. So the general, recommendations for patients with any sort of underlying respiratory disease is to stay at home. That's really the recommendation for all of us right now, but in particular for children with underlying respiratory illnesses. And that really also has to apply to everyone that's caring for this young girl, this young 3-year-old as well, that they are also limiting their going outside. And if they do go outside, to remove their, to really fully sanitize when they come home and before interacting with anybody who has a respiratory illness. That was my first main point. My second main point that this question brings up, and I think that we'll be reiterating this multiple times, is that children do appear in general, now children without a respiratory illness, but children with Li-Fraumeni syndrome and other other children that do not have a genetic predisposition without an underlying lung disease, there does not appear to be as increased risk for severe disease in kids. So I think that those are the two sort of main important points that I wanted to take off that first question. I don't know, Wendy, or anyone from LFSA, if you wanted to chime in specifically for that question, or we'll move on to the second one.
Okay. Wendy, you're on mute. Okay, go ahead.
Yeah. I was just going to say, I think Josh, our pediatrician, is now here. So if you wanted to add anything to that, but I thought that was a great explanation of the situation.
Yes. So, yes, thank you. I apologize for being late. These are crazy times, and Kara knows as we get sort of pulled all of the sudden without realizing, oh, you got to come here and do this for COVID-19, or you got to come and do. So hopefully I'll be here for the next 40 minutes for the remainder of the call. So welcome everyone. I was really delighted when Jen gave us the opportunity to speak to all of you. I know I'm speaking on behalf of Kara, Wendy, and Jenny, who I'm sure you introduced yourselves. I don't know if Luke is on the line or not, if he made it, but we think very much of the LFS community as our family, and so this is very much a time for family, and so we wanted to make ourselves available just to talk and just to be a resource to you. Now, the most important thing, and this has already come out, and we're going to say this over and over and over again, there's nothing differently that anyone is aware of for a person with Li-Fraumeni syndrome and a p53 mutation and someone without a p53 mutation, and their risk for COVID-19, their risk for getting coronavirus, whether they're younger or older, just like Kara was explaining, a great description of that question about underlying respiratory issues, which we'll talk about. So for the rest of the time, we'll be answering your questions, and we'll answer whatever, to the best of our ability, whatever you can. But just as sort of the headliner is, no difference between LFS and not LFS. The best advice that we can give for the current pandemic, which is what it is follow whatever local, community, or state guidelines are set up in your area. Now, we also know that patients with Li-Fraumeni syndrome are more prone to get cancer. And so there are certain questions and precautions that may be related to cancer. But again, it's not the underlying LFS, it's the underlying condition of cancer as it relates to COVID-19. So that's kind of the big picture that, again, we're going to reiterate over and over and over again. And as I guess I'm the only board certified pediatrician, at least on the panel right now until Luke joins us, but absolutely right. So kids, healthy kids without lung issues, for the most part, not teenagers, we're learning teenagers and young adults may be more impacted by COVID-19 than we realized at first, but the younger kids seem to, oh, there's Luke. Hi, Luke. It looks like Luke, oh, he's
doing my best. Yeah.
Okay.
Right.
It looks like
Hey, Luke, welcome.
Luke is either joining us in the hospital or he got new fancy fluorescent lighting in his
In
home.
clinic.
Yeah. Okay. So, Luke, we were just talking about kids with cancer, or rather kids with LFS and kids in general. So with no underlying respiratory issues. We think of kids with LFS just like other kids. They may be carriers. They may have more of an upper respiratory infection, like a common cold. It's more unusual for them to get sicker and end up in the hospital with coronavirus, although it happens. But having Li-Fraumeni syndrome would have nothing, as far as we know, to impact that. Okay? Now, this question about a premature baby, so premature baby who's now a 3-year-old with respiratory, that's someone who would fall in that susceptible or high risk category. And that's the whole point of this bend the curve discussion, right? That you hear over and over again on the news is we're trying to make it so it's less likely that people who are susceptible, whether it's elderly, right, over the age of, let's say, 65, 70, or people who have underlying respiratory issue, asthma, right, lung disease, prematurity. We're trying to avoid the exposure to some of those individuals. And, you know, there's a lot of work going on. I was just on a Zoom call with someone from UPenn. They're looking at new vaccines and new approaches. So a lot going on. And the idea is, let's try to avoid the susceptible people and population from getting this aggressive infection so that we have enough time to come up with new treatments.
All right.
That was a very long introduction. Okay.
That was wonderful, Josh, Dr. Schiffman. Sorry. What we did was I pulled up the questions.
Oh, okay.
And I thought that we could just, I can read them, and if they are more pediatric focused, I'll turn it over to you. If they're more adult focused, I'll try to take it. And if they're just in general, I'll have maybe Luke go first. How does that sound? Or maybe general should be Dr. Schiffman and pediatric should be Dr. Mace.
Sure.
Okay. So the second question is, I know we are not directly immunocompromised by LFS, but could contracting a serious infection such as COVID-19 cause things to go awry and increase the opportunity for cancer cells to develop in someone with our mutation? So Dr. Schiffman, do you want to take that one first?
Yes. So that's an excellent question. And the answer is, we don't really know. And so you can make arguments in many different directions, right? That, oh, if maybe you get an infection, less likely to get cancer. You get an infection, you're more likely to get cancer. We don't have any evidence right now to suggest if you get a bad pneumonia, that you're more likely to get a lung cancer, right? Mm-hmm. So there are some, again, broad brushstrokes. There are some cancers, and this is mostly adult cancers, where inflammation may increase the risk, like inflammatory bowel disease, right? And so in inflammatory bowel disease, the inside lining of the intestines can get very inflamed, and in some situations, much later in life, lead to cancer. But that's a very specific example. I am unaware, and again, Wendy and Jenny, defer to you as well, but I am unaware of any association between getting a pneumonia and then developing a lung cancer later in life. That inflammation connection just has not been described. So I can't imagine that there's any increased risk.
And I think, if I may say as well, I think that, this also brings up some, again, thinking about all genetic syndromes are not the same, correct? And so there's been some research that is beginning. Manuel Rivas at Stanford is leading this, looking for specific genetic predisposition that may predispose certain patients to more severe coronavirus versus more mild. But those are thought to be separate, genetic conditions that are not overlapping with a Li-Fraumeni syndrome. In addition, Dr. Cassandra at Rockefeller University has been studying this now for a few months, looking at young patients, including children and young adults who've had particularly severe coronavirus infections, to look for particular immunodeficiency states that might be prevalent in these patients. And so, but that's a different genetic, condition than Li-Fraumeni syndrome. And right now, we have absolutely no, evidence that the P53 mutations are leading a patient to be immunodeficient.
Right, and something to consider, and this is actually from our local representative, Congressman Ben McAdams, who actually was one of the first Congress people to get COVID-19 and ended up in the hospital. I think he's doing better now, but he had this quote on the CNN, which was very good, which he said basically, you know, you're a young person, you might be able to get over it, but there's no reason that anyone should want it, right? And so it's just try to avoid the risk, because it's for him, it was the worst cold that he's had in his life, and with cough, and just really not a fun experience. So I would say, you know, in terms of Li-Fraumeni syndrome and COVID-19 and cancer, whether you have LFS or not, you want to try to wash your hands as much as you can, and practice, you know, as much quarantining as reasonable, not because of the risk for cancer, because of the risk for COVID-19, right? Because that's what's so unpleasant.
Okay, I think we've started to talk about the, I'm wondering how COVID-19 affects LFS patients. We're sort of talking about that. And then are we more susceptible? And so I think that we've addressed those questions. And so this has been an interesting one because it came up in the chat, and then also it's here, question number 5, which is cannabis smoking. And then there was also another question about vaping. And I'd actually like to, you know, sort of take that one beginning, because I really think that, you know, vaping and cannabis use has become, you know, been on the rise in young patients. Particularly, we're seeing it in our adolescent and 20 to 30-year-old patient population, Li-Fraumeni or not. And I think that, you know, there is, I don't need data to see that if you do partake in some of these activities, it will increase your risk of severe lung complications with any kind of virus. And so, you know, I think that if there's any time to motivate people not to vape and not to smoke and not to use cannabis, this would be the time. This would be the time to try to do it. And I know how hard that is. And particularly with all the stress that everyone is under, this is, you know, something that a lot of us are turning to, you know, other substances, right? And it allows me also to bring up, particularly with my expertise in breast cancer, we know that alcohol use increases the risk of breast cancer, which is a definite concern for Li-Fraumeni patients, as it being sort of the most prominent cancer we start to see in young women. And, you know, when we're stressed, it's natural for all of us to, you know, reach out for substances like, you know, vaping or cannabis or smoking or alcohol. But this is one place where it will increase your risk. And so I'll leave that to you.
Can you explain a little bit more about that? It's not, just so people don't get worried, it's not like one glass of wine you're going to get breast cancer. But can you sort of maybe elaborate on that a little bit more?
Yeah, absolutely. And so, you know, one of the things that we spend a lot of time in our adult practice talking to patients about is how do you still have, you know, a regular relationship with alcohol, and, you know, once you get into adulthood with Li-Fraumeni syndrome and any breast cancer susceptibility. The data is really on more than 2 drinks a day. There is some data for more than 1 drink a day for women increases the breast cancer risk by about 1.5-fold. And so, you know, we really try to say limit yourself to 1 drink a day. So this doesn't mean to say that you have to abstain from alcohol, you know, with Li-Fraumeni syndrome, and particularly, you know, in any sort of extensive amount, but it does mean that you should limit yourself.
So the vaping, I just want to pick up on that for a moment as well. Again, this is non-LFS related, but it's important because LFS people are people too, right? Right, Jen? You'd agree with that? So we're all in this together. So it's no different if you have LFS or not. Some of the there are some anecdotal reports, right? All the studies are still coming up, but there are some reports that the seemingly healthy people with no underlying conditions who end up in the ICU and on respirators, if you dig a little deeper, even though they don't have asthma or they weren't premature babies or they don't have COPD, turns out they have a history of vaping, right? Mm-hmm. And we know that smoking cannabis, I got to be very careful in the state of Utah. I don't want the police to come knocking on my door here and take me out of my office. But it's okay, they'd have to stop and get their temperature taken. So I've got time. I've got time to make it out the window. Don't worry. No. But in terms of cannabis, there are certain, I'm going to be very careful how I phrase this. There are certain people who believe, I'm not going to come down one way or the other, that there may be some benefits in terms of anti-nausea, relaxation, anti-anxiety, stimulating hunger, the so-called munchies, so for patients with cancer. And so one thing to recognize is that there's many ways to get a substance into your body. Again, I'm just stating general facts because this is being recorded, so I don't want to be pulled in front of a tribunal somewhere in Utah and for talking about things I shouldn't. But what I will say is that there are different ways of getting things into your body, and some are safer than others. And so one could, and not advocating, but just explaining that there are, brownies and cookies and tinctures for tea and things like that, which won't irritate the lungs. And if we're talking about COVID-19 and we're talking about risk for susceptibility, anything that harms the lining of the lungs, such as vaping, such as smoking pot, right? That moves you automatically into the higher risk category. So as a physician, as an oncologist, doesn't matter that I'm an LFS doctor, this is regardless, I would discourage as much as possible any type of vaping or inhaling anything that can irritate the lining of your lungs. Is that a fair statement, Kara? You're in a much more liberal state than I am. I want to make sure I'm explaining this correctly.
Well, absolutely. I mean, as an oncologist, we believe that there are many benefits to cannabis for oncology patients. And so, I think that this is always a tough question, but I agree with the way that you put it. Maybe just don't inhale is the right statement right now.
Yeah. Jen,
okay.
So I just asked, Jen, do you want us to keep going down the list of questions, or people are going to write in the Q&As if they have it?
Yeah, if you could go down the questions that were already submitted, and then we can do the Q&A at the end if that works out. Okay.
Sure. Okay.
So great. So then the next one is, I think a really, great question, which is, I had surgery on the 12th of March. I'm currently not in treatment for cancer as I'm NED at the moment. And congrats to the person who wrote that. That's wonderful news. But they're asking, being post-surgery and being NED, are they at higher risk for COVID-19? Dr. Mace, maybe you want to take a question.
Sure. Yeah, so great question. I would say that, being post-surgery or having any, when you speak about a past medical history, I think Dr. Schiffman was address this pretty directly, but being post-surgical, as long as your otherwise general health is okay, it's not going to put you at any more risk for this virus or any other virus. I think that's the important thing to note here. While this virus is certainly garnering a lot of attention and it's having a greater effect on the community in general, and certain populations affects them more than others, there's certainly other viruses out there as well. And so, but specifically for this one, I don't think that is something that I would be too concerned about. And as Kara said, that's great news to be cured of your disease. But, it's more of a, not a post-surgical issue, but more of a, an overall kind of health issue and what else is going on with you at the time. So not something that I would be particularly worried about, and not something that they're seeing patients who have, it's not been reported that patients who are having, just been post-surgery are having more issues with this as opposed to other patients. I think it just depends on, the underlying conditions that has already been addressed.
Yeah, and I might just add to that. People maybe have heard things like, certain types of surgery being put on hold or recommended not to be done right now during this time. That's certainly happening at our hospital, and I'm sure others around the country. And it's not so much that having surgery would put you at higher risk, but that's, you're taking up spots in the hospital maybe needed for people who are needing treatment for COVID. So I guess just clarifying that, the things you hear about, people shouldn't have surgery, it's not that that's a big risk factor. It's more that we need those resources for other things and prioritization.
Yeah, that's a very important point, Wendy.
So I'm just, we have on the line, if I got this right, Jen, right? It's Dr. Kratz all the way from Germany sent that comment. Is that correct?
Yeah, that was just a little bit ago, not today, but a few days ago. Yep.
Oh, okay. So I just want to add something that Dr. Kratz, who's our colleague our esteemed colleague, who is well known to most of us. So he wants to confirm that smoking marijuana is especially bad for teens with Li-Fraumeni syndrome due to its genotoxic effect. Healthy individuals respond to genotoxic substances like THC by killing cells with genetic changes caused by these genotoxic effects to prevent these cells from transforming to cancer. In LFS, this normal response is impaired and the cancer risk is increased. Warmly, Christian, Dr. Kratz. Okay, so it's an important point. We were talking about smoking in relationship to COVID-19, but he brings up an excellent point. Smoking in relation to Li-Fraumeni syndrome is actually terribly bad, whether it's smoking pot or not, because of what he was describing. Lung cancer, we know, is directly related to smoking because of the DNA damage that the smoking entails, and that's also true for cannabis as well. So I go back to my very nuanced statements that there are many different ways for a drug to enter a person's body, and it's very important to make sure you know what those ways are and that they aren't causing damage. And that's all I'm going to say about that topic. So,
all right,
let's keep going.
All right. So, so the next thing I think is something that I'll be very interested to hear how Dr. Schiffman, you guys are dealing with it at your institution, but it's been something that has definitely been a challenge. What advice do you have about postponing our scans or things like preventative surgeries? These aren't emergency care, but are important. I'm nervous my MRIs will get postponed. So I'm going to start off because we had our sort of Li-Fraumeni group call with Kristen Zelli, who's a genetic counselor that works with LFSA that you guys potentially know very well, and our physicians at CHOP and on our side. And we've made this sort of decision, at least in our practice, that Li-Fraumeni syndrome is a high enough risk cancer syndrome that we are not going to postpone scans in patients who are otherwise healthy. Now, this has been a difficult decision, and we're trying to weigh what level of risk warrants continuing cancer screening scans, because certainly on, say, the other side, a healthy 40-year-old woman with no family history of breast cancer, we are recommending that she would, say, for example, not do her mammogram. Or a generally healthy, no family history of colon cancer 50-year-old should not come in and get their colonoscopy. So we recognize that this is, going to be very different, which is that we are recommending still our scans to be done for our Li-Fraumeni patients. Again, recognizing the risks of bringing those individuals into our healthcare system. This is, at least on our site, a constantly changing decision and paradigm. I actually was going to reach out to my New York colleagues at Memorial Sloan Kettering to see if they've decided to suspend cancer screening in their high-risk individuals, given how inundated they currently are, and sort of the increased density of risk. So as it currently stands, to summarize, we are still doing our MRI screening, but we are not recommending any prophylactic surgeries. And again, this gets to Wendy's point, which is not because surgery would cause an increased risk, but because we need those resources in the hospital to be used to care for coronavirus patients. And so all elective surgeries, regardless of your underlying genetic condition, at least in Pennsylvania, are being postponed. And I believe that that's the right decision. Dr. Schiffman, any thoughts on, and what are you guys doing for scans?
It's an interesting question. I'm gonna punt to Wendy and Jenny because we need to hear their voices and their thoughts on the topic. That's mostly because we don't have an answer.
Yeah, we have been postponing our screening here. This is a little bit more of a directive from our MRI and imaging team, just in terms of they're not doing screening procedures. We've put a halt on screening mammograms, a whole range of things. Also, I think, we have a really large portion of our population that we follow travels a significant distance to come here. So coming for their scans would involve, stopping at gas stations, stopping at restaurants, spending a night or two in a hotel, because there's often multiple family members, and it's usually a several day visit. So we have been, and Luke has done, started last week with these types of sessions, but we've been doing video conferencing with our patients, so that we can really do an assessment, because certainly if someone is symptomatic, then it's a whole different range, decision process. So we're trying to even remotely have a face-to-face kind of contact with the patient, and assess their individual situation, and then make a call on that. But I'm really glad that this came up because, for a lot of patients, those screening dates are a big deal and something for a while and really count on for having those checks and getting that reassurance about their health. We do want to provide reassurance that delaying things a couple of months is unlikely to be particularly significant in an unaffected or someone who's asymptomatic. So I'm glad that we can kind of have this discussion about that and how everyone's handling it. Jenny, what did you have you been hearing from people?
I would just say the only thing that I have to add is that even though we're kind of thinking about everything on an individual basis and postponing everything, we're still meeting weekly, still going through patients, still communicating with patients. And so though it seems like, some of the in-person visits are being put on hold, I would say that the care has not. And so in terms of still communicating with everybody, like we're still getting emails, we're still scheduling things, it's just going to be pushed out a little bit further. So, and I would reiterate everything Wendy has already said.
And I think that just to make a little bit of a clarity with my statement too, is that, we do things yearly, right? Just because that's sort of the way we do them. But it's not necessarily that year date is an absolute set in stone. So, for example, a new Li-Fraumeni patient that I'm seeing who's never been scanned before, I'm going to try to, see if I can get that patient in for their screening. Somebody who I see and has had, 6 negative brain and full body MRIs over the last 6 years, I'm strongly encouraging that patient to wait. So it is definitely an individualized discussion.
Yeah, I think that's a great point about the new patients, Kara. We've really struggled with them and just, and just because they're going through a new experience of, they've been given this diagnosis and, what does that mean for them? So getting that first scan and screening it is often a really important part of that diagnosis. Luke, it looked like you were going to add something.
Yeah, I agree with whatever, everyone's saying. I would also stress that, and people know this, and maybe Kara might have mentioned this in the beginning, but these things are constantly changing. The situation changes from day to day. And as far as, who's doing what for these COVID preparations could change. And keeping that in mind as a patient in a population, a special population of patients, I think it's important. So you all aren't blindsided by some of these things, but these things can certainly change. It's changing here on a day-to-day basis, and so you just don't know sometimes, and that makes it hard for you all. And we certainly get that, and we're here to try and make it as easy as we can. But there are some things out of our control. There is a a question on the chat that said MRI for kids who need anesthesia would be postponed first. Yeah, I wouldn't recommend any kid being intubated now or even needing anesthesia. I think I would certainly recommend delaying those things for children at this time. Just more contact, with other people and other things is something that can probably be delayed.
And we're actually getting a lot of questions that are coming in, that are emailing, and that people ask, and I think we can address this, is, and again, this falls under the same rubric of no different for an LFS patient than for any other cancer patient or anyone else in the community. Okay, so the question's the same flavor over and over again. I've had cancer, I've had multiple cancers, I've had, treatment, I've had a lung removed, I had a transplant a year ago, 10 years ago. Am I at risk? And the answer is yes, but no different than any other patient who had cancer, right? So one of the susceptibility, these high risk patients, we talk about the elderly, people with underlying lung conditions, and those who are immunocompromised. So getting chemo, I mean, one question from a person who had 7 different cancers, that's a lot of chemotherapy. Chemo, radiation, transplant, all of that leaves you immunocompromised, so a lower immune system than the general population. And the reason that that's a risk is because if you get the coronavirus infection, you can still fight it off, but it will take your body longer to respond. And the longer it takes your body to respond, the higher your viral load, meaning the more that coronavirus is going to be dividing in your lungs and making you cough and have symptoms. So if you are a person, it doesn't matter that you had LFS, but if you are a person who has had chemotherapy or radiation in the past, then you are someone who's at higher risk, and you should be extra vigilant about exposure, right? Which means, don't go out to the beach with a bunch of people or the public or so on. The other point that's important to remember is because kids are less symptomatic, you say asymptomatic, they may not have the same cold or cough. Don't be fooled and have lots of kids over your house, right? Because they may not have symptoms, but if you're immunocompromised and they shed the virus and then you get it, then you may get quite sick. And that's what we're trying to avoid. Again, we're not trying to create fear or panic. And again, absolutely no different what we're saying than what you hear on the news or you read in the papers. Do people still read papers? Do they get them delivered? But anyways, what you see or hear or read, people who've had cancer, who are immunocompromised, are at higher risk and should be extra vigilant about trying to avoid exposure to this virus.
But Josh, I think there's a clarifying question here, is how long in the past does that mean? So I think it's important to clarify for patients who are currently NED cancer survivors.
Yeah. So
how long in the past does that mean?
So the reason I'm smiling is there's no right answer, right? And Karen knows this. So if you've had chemotherapy a year ago, your immune system's probably not back to normal. If you had it 5 years ago, it might be more normal, but not all the way. If you have 10 years ago, it's hard to say. We don't really know. It depends how much chemo you had. So a rule of thumb is the more chemo you had, right, the more often that your white count cells drop, that you became neutropenic and immunocompromised during your therapy. If you had multiple rounds, then the more likely you are to actually be at risk for being immunocompromised. If you had radiation therapy to your lungs and it was 40 years ago, you're still at risk, right? Because radiation therapy causes damage to your lungs that persists. So it is an individual by individual case. If you've had only a little bit of chemo and it was decades and decades ago, then you're probably closer to a normal immune system. But the question really would be, why risk it, right? So if you know you've had any exposure in the past, even if maybe your immune system is back to normal, we don't want people to be paranoid. And again, nothing to do with LFS. This is purely oncology, immunology, infectious disease. Nothing to do with underlying LFS. But if you've had chemo or radiation in the past, it would be smart to, again, always follow the rules of your local community, but to whatever extent possible, try to stay at home and avoid exposure. Kara, you're nodding, so I'm hoping you agree. Yes, thumbs up. Okay. Oh, we just got an interesting question about ACE2 receptors.
Oh, wow.
Very sophisticated group. So here, COVID-19 binds to ACE2 receptors in the lungs. Some of the effects of the ACE2 receptors are TP53 dependent. Could it be that LFS patients have less risk of developing serious form of COVID-19 infection? So that goes into the big, we don't know, and we don't have any evidence to suggest one way or the other. But this is an important point. Again, nothing to do with LFS, but I think it's important to cover this. And this is something that's very near and dear to me as someone who takes antihypertensive medicine, okay? So ACE2, so angiotensin converting enzyme. So just a little biology. We have lots of molecules and hormones and proteins, peptides in our body, and they control different aspects of what we do and how our body responds. And so one of those is called an ACE. The ACE is, if you have a lot of ACE, that can lead to higher blood pressure, okay? And that's just one of the reasons people have high blood pressure. They just naturally have higher levels of these ACEs in their body and things in the ACE pathway. And so there are medicines that are ACE inhibitors that basically block those ACEs, okay? Those ACEs, anything in your body binds to a receptor. There are ACE receptors on your lungs. Well, guess what? COVID-19 binds to those ACE receptors. Kids have less ACE receptors than adults, which may be one of the reasons why kids are not as severely impacted from coronavirus, because there's less virus to bind in their lungs because there's less receptors. Theoretically, right, just in theory, if you take an ACE inhibitor or you take an angiotensin receptor blocker, but not a calcium channel blocker, they're all different types of medicines, but an ACE inhibitor or an angiotensin receptor blocker, those work on those receptors, and maybe that would increase the risk of getting coronavirus infection in your lungs because you have more receptors. But the truth is, and there are many articles, I just read one yesterday, there's no evidence that that's true. And in the absence of any evidence that that's true, and this would go to P53 in the Li-Fraumeni question in ACE receptors, but in the absence of any evidence that there's a direct connection clinically, the World whatever Cardiology Association has come out with recommendations is that people should absolutely stay on their ACE inhibitors, should absolutely stay on their ARBs. It's much worse to have high blood pressure, which by the way is a risk factor for more severe infection. Much worse to have uncontrolled high blood pressure than a theoretical risk of an increased infection of coronavirus. So sort of went on a tangent there, but it's part of the misconception. Has nothing to do with Li-Fraumeni syndrome, but it's important to understand. If you're taking an antihypertensive, stay on your antihypertensive. Don't switch to a calcium channel blocker. All the evidence right now today at this moment in time tells us there's no reason, no need to switch. Switching would be actually worse. In fact, one of the articles I read said it's much more likely that you'll get a coronavirus infection if you switch your medication and have to go to the pharmacy and pick up a new medicine. You'll get coronavirus going to the pharmacy. Better to just stay at home on your current medication. Not bad for a pediatrician, huh, Kara?
That was wonderful. I'm very impressed. Stay on your antihypertensives.
Yes.
So I'd like to actually address this question about giving blood. So, because I think many of the questions, just looking through them, are all kind of along the similar theme that hopefully we've hammered in, that Li-Fraumeni is not an increased risk for coronavirus, outside of the same things that we've been talking about, makes you at risk, that is regardless of whether or not you have Li-Fraumeni. But this question is a little different, which is, are we able to give blood or should we not be giving blood? So it is an absolutely wonderful, wonderful thing right now. And it's kind of the one place where the social distancing, measures, I do actually think can be relaxed. We are all going to facing blood shortages at some of the hardest hit places. And so healthy young people who can donate blood and are at low risk for coronavirus, it is an absolutely wonderful thing to do, to go out and donate blood. Now, to do that, I would say to look for an American Red Cross run donation at a hospital that is near you. And if such one does not exist, don't go out trying to find one, right? So you want to be donating blood at a place where all the proper precautions are being taken. Now, as far as Li-Fraumeni donating blood, a genetic condition does not prevent you from donating blood. And even if you've had cancer, if you are not, the guidelines are that if you are over 1 year past your cancer treatment with no evidence of disease, you are eligible to donate blood. Of course, there will be individualized eligibility questions, by the American Red Cross when you do that. But you are able to still donate with Li-Fraumeni syndrome. Now, I don't know if I've said anything incorrectly, and so I'd like to hear if there's agreement among the panel. And again, I don't want people to run out and try to find a place to donate blood and put themselves at risk. But if you have a well-run, safe way to do that, and it's something that you do feel that you want to do, because I do know that it makes people feel, that they're providing a good service, and it is a good service, I do think it's fine to do.
Luke,
Now,
any
so
thoughts?
someone said I was told I was never going to donate blood with LFS. I have not ever seen anything that should be the way it is, but please tell me if I'm saying something incorrectly here.
The risk for blood donation is for the recipient is fairly low, right? Because there's not a blood cancer. Well, there are blood cancers, but there's not a blood cancer that you would spread by giving red blood cells. Okay.
Right.
And the benefit is much greater than minimal to no risk at all. There was a question that popped up about organ donation. That's different. Okay.
That's different. Yeah.
So when you're donating an organ, if you have Li-Fraumeni syndrome, this has nothing to do with COVID-19, that organ itself has cells in it that are, if they only have one P53 gene that's working and one that's mutated, then there is a risk of that, that organ turning into cancer. But there's exceptions to everything, right? If you have a family member and you're the only match, and that family member would die otherwise, and there's no other organ, then you have to have a discussion and weigh the risks and what organ is it and what's going to happen there. Same is true for bone marrow transplant. We would try to avoid a bone marrow transplant from one sibling to another if one sibling had a known Li-Fraumeni syndrome. But if there's nothing else that's an option, then you need to have those discussions. But donating blood, there's no biological reason that I could think of. Even the same is true for platelets, right? And usually those are the two things, platelets, and then there's plasma. There's certainly for FFPE or FFP rather, for cytokines and clotting factors, no biological reason why a patient with LFS couldn't donate. And right now is a time when we absolutely need blood in our hospital for patients who are sick and septic and in respiratory failure. I don't know though what the Red Cross policy is. I'm only telling you from a biological perspective.
Yeah, just to put maybe some people at ease is that blood cells that are donated only live in the recipient's body for a short period of time.
Right. Yes.
So, you're not giving them a cell that would stay in for a very long time. But remember also, and, that these are individualized, decisions, of course, again, and, require going to potentially talking with the Red Cross, and, not to say that, that this is something you should necessarily have to do, but there is also the ability to do a financial donation if you feel uncomfortable, with donating blood, particularly to the American Red Cross, and it's certainly a place that, is in need right now.
Yeah. So just another question came in. We're at the top of the hour. I can go for a few more minutes. I think this is really important, but I know that we've got people who are really busy, but we'll bring in our genetic counselors who were brave enough to join us on this call. So one question that came in that we didn't really talk about too much, not related to COVID-19, is what screening do you recommend, or any screening, for VUS mutants? Okay, so we got to break that question down. There's a lot in there. I'll start by saying, a VUS, a variant of unknown significance, wouldn't necessarily be, what we call in the pathogenic mutant category, right? Because that's when you have a P53 change, and it's not quite the normal sequence in the DNA, but it may be not a sequence that you would predict would cause a problem with the P53 gene. And there are a couple of different ways to answer that question. I'll take a quick stab at it, but the genetic counselors are the ones who are going to be better, and they'll correct everything I say wrong. So the first is, if you are being screened as an individual patient because there's a strong history of cancer in your family and you yourself have cancer, or you had multiple cancers yourself, so there was something that met the criteria that you as an individual were at high risk for a P53 mutation, and that's why that test was ordered. If that is truly a variant of unknown significance and is not pathogenic, there could be other reasons, depending on the circumstances, that still puts you at high risk for cancer, even if it's not P53. So there could still potentially, every situation is different, so it's very hard to answer this in the vague terms, but if you're very young, you've had multiple cancers, there are multiple cancers tracking in your family, then there's not necessarily a category that you would fit in that you should have this specific screening, but it is something to think about. The challenge is, if you have a variant of unknown significance and it's not predicted to be pathogenic, insurance, our friends in the insurance company, may not always pay for the screening. I'm going to take a pause before I get in over my head. I'm going to let Wendy and Jenny try to answer this question a little bit about VUS and P53 and screening approaches.
So I'll kind of take a quick stab at it. I think VUS screening, and I think VUSs in cancer genetics are a problem regardless of whether it has to do with Li-Fraumeni syndrome, but specifically when we're thinking about whole body MRIs and brain MRIs and getting insurance authorization, it can be a particularly difficult question. And so I think what we've tried to do is make sure that we understand, exactly what's going on in the family history, as Dr. Schiffman has alluded to. So trying to figure out who else has been diagnosed with cancers, what ages, what types of cancers, and then using that as a guide to help make the decision for screening. And then on top of that, knowing exactly what type of mutation it is and where it is in the gene, and kind of thinking about some of the, we call them lines of evidence that point towards pathogenicity, trying to kind of weigh what the genetic mutation looks like with what the family history looks like to try to come up with some sort of plan. So without all of that information, it's kind of difficult for us to really provide an accurate screening plan. I don't know if you have anything to add, Wendy.
Yeah, I think it's important to note that, it's not that a variant is like just benign, just pathogenic, or just VUS. As Jenny said, there are these lines of evidence, different types of data that we use that help us, determine which of these buckets people fall into. But for every variant, there's going to be different amounts of data and evidence available. So, we may have to test identifies a variant that's being classified as a VUS, but there are maybe several lines of evidence pointing towards that being pathogenic. And we will, we try to work with the lab to see what could we do to maybe provide that last line of evidence that may help with classification. You have other things that are classified as VUS that really there's not much data suggesting that it would, and you don't have a lot of data completely reassuring you that it has no effect. So, I've gotten emails, from patients before, from around the country of, what do you do? Will you guys screen someone who has a VUS? Well, it depends on what the VUS is. And so because maybe someone with a VUS who had a family history that met classic criteria for Li-Fraumeni syndrome, there was many things pointing towards them needing that type of screening. They may have gotten a very different recommendation than someone who was not anticipated to have Li-Fraumeni syndrome. This VUS was identified incidentally on a panel, and there's no evidence suggesting that it really would cause a problem. It's just rare and not seen. Those people are going to get very different recommendations. So I don't think any center can say, oh, we have we either screen or don't screen someone with a VUS, because a VUS is not one thing.
So we're getting a few questions that are coming up on the Q&A, not on the chat. And so I just want to answer, there's three questions I just want to go through very, very quickly and invite my colleagues to jump in. And I know we're a bit after hours now. So first, metformin in the news as remotely possible COVID-19 treatment. Can you explain the use of metformin in studies for cancer prevention? We get this from patients all the time, regardless of COVID-19, right? And so, first of all, I have not seen the COVID-19 metformin reports yet, but like everything else, even the chloroquine, the anti-malarial drugs, you need randomized clinical trials before you would make sure that it's actually useful. And that is the answer as well for cancer prevention. Metformin is a drug that's used to control diabetes, and there's been, again, observation that maybe some patients without Li-Fraumeni who take metformin might have a lower risk of developing cancer. But we need to have a large definitive study, which is currently being planned. I don't know if it's open yet. Do you know, Kara, if it's open, or Wendy?
I don't know.
Yeah, but there has to be a large randomized trial that basically takes patients with Li-Fraumeni syndrome, gives them metformin or gives them a placebo, and follows them and says, okay, this actually works. In the absence of that, there's just not enough compelling evidence to say all our patients with Li-Fraumeni should take metformin. If there was, we would have you all on it right now. Right, so we need to study the question the right way. So just in the same way that at the COVID-19 press conferences, where Dr. Fauci stands up, he says, we need a randomized trial. We can't tell you it works till we have a randomized trial. It's exactly the same for metformin. We can't tell you this works or doesn't work until we've studied it. And so there's not enough evidence to do that. So that's one. Two, there was a question about metastatic cancer. Is it safe to assume that patients with metastatic cancer are considered immunocompromised, regardless of what therapy on? Yes, that's actually true. If you have cancer, cancer itself may interfere with your immune system. So you should think of yourself, if you have metastatic cancer, if you're actively undergoing cancer, in the susceptibility treatment area. Now, next was probably very relevant. This crosses actually the LFS COVID-19 barrier, right? Stay away. Okay. screening for COVID-19 sometimes is CT is done because it's a very characteristic finding on the lungs.
Mhm.
If you have Li-Fraumeni syndrome and you have symptoms of coronavirus and someone wants to do a CT scan on you, do it.
Yeah.
Absolutely. The risk from CT is theoretical.
Yes.
The risk from COVID-19 is real.
Yes.
Okay? So you need to know if you have COVID-19 and you need to get that CT scan. And by the way, this theoretical risk is after dozens and dozens and dozens and dozens and dozens of CT scans. So
Yes.
we always tell our patients, you have to do, Wendy and Luke and Jenny have heard me say this over and over again, if there's a choice between a procedure that's going to save your life or make an impact on your care and a theoretical risk that may or may not make a difference, we don't even know, always do the procedure. Always, 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 always. So if a doctor, right, don't go to some like CT store on the corner and get a CT scan, but if a doctor tells you we need to do a CT scan because we're worried that you might have COVID-19 and you have Li-Fraumeni syndrome, do the CT scan. Don't even be nervous about doing the CT scan.
Yes.
You're not going to get cancer from your CT scan. Oh, and I'm seeing actually a couple of people have asked this question too. All right. Oh, then there was a question about someone who's, you know, who's got Li-Fraumeni syndrome, had a history of cancer, and they're in the workplace, and someone has COVID-19. Don't go to work, right? I mean, that's the same. It doesn't matter if you have Li-Fraumeni syndrome or not. If you're immunocompromised, and you would be if you've had multiple cancers, then it's better to stay away from work if you can, unless you're essential. Go ahead, Kara, please.
Oh, no, I was just going to say, and I just had put it in the chat, but just to say it, if you do hear about this, this is happening to many of us. We're hearing about COVID-19 positives in our building, you know, or our workplace. The best thing you can do is monitor your temperature at home and look for signs of an increased fever and then signs of difficulty breathing or other upper respiratory tract type symptoms, cough, that sort of thing. So right now, we are not testing people, at least in Pennsylvania, if they are asymptomatic with an exposure. This is unfortunate. We hope this changes. But if this is the way it is in your state or country where you are, the best thing to do is to not go to work and to monitor yourself for fever and symptoms.
All right. How about one last question, and Jen, we'll let you pick it.
You can't put that pressure on me, but I know this was on the news. How about you answer the ibuprofen question? Because that's many times. I heard it on the news, but and I heard what they said about how that came about, but I'll let the experts here answer that.
Luke, go for it, Luke. Finish it.
There was a question, and I typed an answer on the chat, my 2 cents. I would say that this goes to another general theme, and what I've been telling people that I see here and other colleagues and nurses and everything. If you hear something, it's important to try and talk about it with someone who may have some sort of expertise in this area. So we're experiencing this a lot in the hospital. People are spreading certain items of information that aren't true, and it kind of compounds on itself. And so I actually didn't see this, and so I was doing some reading while Josh was talking. But I think in general, many of these things that are being brought up by people who may not be in the know may have an anecdotal experience with something, which means just one particular story about something that they experienced, but isn't necessarily going to be true in the data and doesn't necessarily make biological sense. Maybe there is some sort of rationale for it, but it's not something that is helpful to really make these assertions when you're not sure. And you do see that a lot of this in certain, panic type situations, whether it be a virus or something going around or some other thing, some sort of terrorist, whatever is going on, people will make assertions and not really know the facts. And I did put up a link on the chat to an article that I took a quick look at. It's a really short article about why it's being thought about, but that there's really no solid evidence. And I would say the question on the chat was, if I have a COVID-19 infection, should I be taking ibuprofen? What if you actually have an infection with this virus? You should be taking directions from your provider who's giving you care. I wouldn't tell you what you should or shouldn't do over a web chat. I would say that if you have that question and you actually have an infection, you need to talk to your provider and ask them what they think, because that's their kind of purview and that should be their responsibility to take care of you. I would say that if you take ibuprofen for normal reasons, prescribed for whatever kind of issue you may have, you should continue to do that. Just like Josh said and Kara said with the blood pressure medicines, you should take the medicines that you are prescribed to. There's no data out there that says you shouldn't. And so, but that's separate from the question of actually having an infection, which should be managed by the person.
The other thing about ibuprofen and Tylenol, and this is important to remember too, is if you have a headache, not a COVID-19 headache, right? Because you're still allowed to get headaches. Or if you have a muscle pain or some reason that you can choose, oh, should I take ibuprofen or should I take Tylenol? Well, just take Tylenol and then you don't have to worry about the ibuprofen, right? That's a very easy answer to that problem. If you're taking the ibuprofen for like rheumatoid arthritis or a problem where you need it, then keep taking it because again, it's a theoretical risk. My favorite question just came up about radiation dental screening and panoramic x-rays. I can't hold back. Okay, so I don't know if there are any dentists on the phone, so I'm going to be very careful, very, very careful about what I say. It seems to me that dentists love to take a lot of x-rays of our teeth. And I'm not a dentist, so I'm not going to comment whether those x-rays are actually needed or not, but it seems like every time I go to the dentist, I get a big scan of that. So I do this for my kids too, and they don't, as far as I know, have Li-Fraumeni syndrome, but, and I advise all my friends, have a conversation with your dentist and say, is it really necessary to be taking that many x-rays? All of that. If you have a tooth pain and you have a cavity and there's a reason to take it, great. But maybe there's a way to just get a baseline like once every couple of years.
Yes.
That's regardless of Li-Fraumeni syndrome, because it's never good to get extra radiation if you don't need it. So that's how I would respond to that.
Dr. Schiffman, I'm so glad to hear that you and I have the same feelings. You know, I even have a letter for my patients to bring to their dentist.
Yeah, we've done that.
Okay, yes. Kara, can you share that with us so that we can get it out for everybody?
Yes, I'll make sure that
it truly is one of the most common questions we hear all the time. So I would appreciate that letter if you could email that to me for everyone.
I will 100% do that.
And again, it doesn't mean you're going to get jaw cancer because your dentist is taking all these x-rays, but
no, of course not.
But no one has explained, no one in the dental community has yet been able to explain to me, maybe I'll get a lot of emails and this will go viral, but no one has been able to explain to me why do you need so many x-ray every single time I go to the dentist? But maybe there's a reason. But I would say if you can avoid it, if you just have a conversation and just say, and they don't push back. It's not like, it's sort of the default is get the x-ray, but if you have a conversation, say, I would prefer not to get it, okay, then you don't get the x-ray. So it's very easy. So get the letters from Dr. Maxwell is what I would say.
All I know is at the symposium, if the energy gets low, I'm going to ask this question to the two of you, and then everyone will be all like,
yeah, for sure. All right, we better.
Thank you so much, you guys. I really appreciate it.
Braces and MRI. Talk to your radiologist. We just have to have like a 4-hour panel at the big LFS meeting to answer all of these, because they're really, really good. So the bottom line, I'll say. And maybe we'll just go around very quickly. Everyone say like a 30 seconds. But the bottom line is wash your hands. COVID-19 and LFS, there's no difference if you're an LFS patient or not an LFS patient. Watch the news. Don't get scared by the news, but watch the news and whatever they recommend in your community, your neighborhood, in your state. That's what you should be following. And if you have questions, certainly ask your doctor. The good news here, if there is any, the silver lining is we don't expect and we don't have any reason to understand that patients with LFS are going to be any different from any other person on the planet when it comes to COVID-19. Other concluding thoughts from the rest of the panel?
Thank you for inviting me to be part of this. You know, I really do believe that the LFS community is a family, and you know, I guess what I'll put my plug in is, besides hand washing, watch your mental health over this time. It is hard to have a genetic mutation that predisposes you to cancer, and it is really hard to now have to be forced to be at home and you know, have a lot of time on our hands, and it's hard for all of us. So important to remember that, meditate, whatever it is that helps you, but please take care of your mental health in this difficult time.
Agree. LFS and this are two separate things, and they should be treated that way, but keeping in mind that you all are special. I would just answer this question: LFS shouldn't be the reason to not come to work. I think that's, you know, a personal decision, again, following your community recommendations, but I would say LFS isn't a reason to not stay at work. And then the two things I'd say, again, is be flexible. As I said, things are changing on a daily basis, and they will continue to, for the general population and for people with medical conditions. And two, when you hear something, again, be you know, cognizant that where you're getting information, and if you need to, you know, there's certain places like the CDC, the WHO, your local hospital. We, you know, here in Utah have a website people can go to. Pennsylvania, I'm sure, has several as well. And so, you know, go to your local academic center's hospital site to get information, because that's where people are vetting that and thinking hard about it. So thank you.
Yeah, and I agree with everybody. I think the one thing that I did want to bring up was taking your mental health seriously during this time. So if anybody needs resources or needs a good meditation app or good YouTube videos to stay active at home, let us know, and that's something that we can help with.
Yeah, if you could share those, Jenny, we'd love to be able to post those on the website for everybody. We can put it under the COVID section, and just in general, it's a great resource all the time.
Yeah, of course.
Really appreciate that.
Yeah, and I think I probably speak for all of us on the panel as well as all the other providers out in the country, but your Li-Fraumeni team is probably still at work and either remotely or in the office. And so, you know, don't hesitate to reach out and talk to them with questions or report symptoms. We're still there to help.
Well, I just cannot thank all of you enough, really, from the bottom of my heart, and I mean that sincerely. And as I mentioned in the beginning, this is really just such a layer of comfort for everybody, and just a really challenging time that we're all trying to navigate through. And just everyone be safe, be well, and stay connected. As I mentioned in the chat, we will send out an email blast as soon as this is posted on the website with the link on how to get there. So everyone, I know people want to rewatch it, and if there's any other questions, don't hesitate to email us at info@lfsassociation.org, and we will get any extra questions we might have missed or that might come in on email that I missed during this, and we'll make sure that we give it to this panel, and we'll get any questions answered for you. So thank you so much, everybody. I look forward to seeing everybody personally in the fall. That's my goal. I intend to be there in the fall no matter what. We're going to do this, and I really feel if we just believe it, it'll happen.
So Jen, let me just say that, again, we said we are a family, and we are all going to get through this together, all right?
Yes.
And we will come out the other end, and we'll do it as a family, so as a community.
That's right.
So thanks to everyone for joining in, and we look forward to seeing everybody in the fall, if not sooner.
All right, keep smiling, everybody.
Absolutely.
Thank you.
And Purell.
Purell. I like it.
All right.
All right. Thanks, everyone. Take care.